What are SSRIs, and how do they treat phobias? Imagine feeling anxious every time you see a spider or have to speak in front of a crowd. Now, picture a medication that can help calm those intense fears. That's where selective serotonin reuptake inhibitors, or SSRIs, come into play. These medications are mainly used to treat depression and anxiety disorders, including specific phobias. They work by boosting the level of a brain chemical called serotonin, which helps control mood and fear responses. Normally, after serotonin helps transmit signals between brain cells, it gets reabsorbed into the cell that released it. This process is called reuptake. SSRIs block this reuptake, so more serotonin stays in the space between brain cells. This increased serotonin helps improve communication in brain circuits that regulate anxiety and fear. As a result, the brain's response to feared objects or situations becomes less intense. When treating phobias, SSRIs help reduce the overwhelming anxiety and fear that often come with these conditions. They make it easier for people to face their fears gradually. But keep in mind, these medications don't work overnight. It usually takes several weeks, sometimes up to 4 or 6, to notice a real difference. During this time, the brain adjusts by changing how it responds to serotonin, which helps lessen the phobic reactions over time. Many doctors recommend combining SSRIs with therapy, especially exposure therapy. Exposure therapy involves gradually and safely exposing someone to their fear in controlled ways. When combined with medication, the person's anxiety levels are lower, making it easier to participate in therapy sessions. This combination often leads to better long-term results. Some common SSRIs prescribed for anxiety and phobias include fluoxetine, sertraline, paroxetine, citalopram, and S-citalopram. They tend to cause fewer side effects than older antidepressants. However, some people might experience nausea, trouble sleeping, or sexual side effects. It's important to talk to your healthcare provider about any concerns. If you're thinking about using SSRIs, remember to discuss this with your doctor. They can help determine if these medications are right for you and how they fit into your overall treatment plan. Always follow their advice and report any side effects promptly. Never stop taking SSRIs suddenly without medical guidance, as this can cause withdrawal symptoms or a return of anxiety. In summary, SSRIs work by increasing serotonin levels in the brain, helping to calm anxiety and reduce fear responses. They are most effective when used alongside therapies like exposure therapy. This balanced approach can make facing fears more manageable and support your journey toward overcoming phobias.